One of the things that people come in and ask us for most is, how can you help my hollowness under my eyes? Often it's accompanied by dark circles, or maybe it's just I'm feeling really tired and looking really tired. What can I do to help that? And it is quite a tricky area. It's a delicate area. It's close to the eye. People are concerned about that. And so often a multifaceted approach is required. There isn't really a one option fits all treatment. The things we would consider, depending on the degree of hollowness and the main sort of areas that you might be concerned about, would be, well, one of the sort of mainstays of treating what we call tear trough deformity or hollowing under the eyes would be a dermal filler. Now, in our practice, dermal fillers have slightly fallen down the pecking order, because my personal opinion is, even done really well, and we've done a lot of dermal filler under the eyes over the years, even done really well, there can be issues. Filler can migrate, it can end up looking a little bit so you can see the filler. It's a very tricky thing to do. So if you can avoid using large volumes of filler and use something else as maybe a precursor, then I think that's a much better option. So what would we use to sort of prepare the ground, as it were, for other things? Well, we can separate it really into injectables that are going to affect the collagen side of things, and more external treatments that are also looking for tightness or resurfacing or changing of pigmentation. So initially, let's talk about the injectables that we might consider. I think the mainstay these days under the eyes would be polynucleotides. Polynucleotides are everyone knows about polynucleotides now because of the social media and TikTok and things. Salmon sperm is or the salmon sperm facial, the salmon sperm treatment. And it's because that's where we get the polynucleotides from. There's a lot of salmon around, there's a lot of salmon sperm around. You break down salmon sperm, all that's in the sperm is DNA, and polynucleotides are fragments of DNA. When you inject these fragments of DNA under the skin, they act as cellular messengers. They upregulate, they interact with skin cells to do certain things. They upregulate collagen formation, they downregulate collagen destruction, and they also upregulate the destruction of melanin, and they downregulate its production. So you've got this sort of thing that is going to give you more collagen and less melanin. So you're hoping that's going to improve volume under the eyes, but also and help with discoloration. They work really well, but they don't work for very long. It's like thinking, I tend to think of polynucleotides fitting much more into the sort of the Botox family of things. You're going to have them done on a relatively regular basis, but when you have them done, they work really nicely. How might we affect the skin under the eyes from an external treatment? Well, here things like cool peel laser are fantastic for helping with skin texture. You can do microneedling under the eyes, especially if you add exosomes to it. Fantastic for skin texture there. And perhaps the final thing will be soft wave, because soft wave works everywhere, so why wouldn't it work under the eyes?